Hi everyone, thanks for tuning in today. I just wanted to touch quickly on a few of the ways that we may still be feeling fatigued, even if we are following the sleep hygiene recommendations and even using maybe an electronic app or something like that. If you're still feeling quite fatigued throughout the day and you don't really know why, I would encourage you to investigate that and to seek out help from your physician or your pharmacist to investigate as to why this is happening. The reason being that if you are fatigued and if you are chronically feeling exhausted, there is a reason for it. And I would encourage you not to accept responses from healthcare workers who may tell you that, oh, it's just old age, or oh, this is just normal, I'm tired from day to day too. We're all tired sometimes, but being chronically fatigued, if it's not diagnosed as a disease or some kind of chronic illness, is something that we should investigate, and you don't have to accept that answer. If you are feeling chronically fatigued and you are following the recommendations that I have spoken about in my videos, I would encourage you to maybe ask your doctor for some blood work. They could look at your iron levels and see if your iron levels are low. Sometimes people are not getting enough iron through their diet. What they really need to check is they need to check your serum ferritin levels. These are the levels of iron that are in your body that help to make hemoglobin, which is responsible for transporting oxygen to the tissues in your body. Beans, lentils, chicken, and spinach are a few of the ways that we can get iron through our diet. However, if you do have very low iron levels, your doctor or pharmacist may recommend that you use an oral iron supplement, and this is necessary from time to time. Usually when you start taking an iron supplement, it takes a good 2 to 3 weeks for you to start to feel more energized and more refreshed. At this point, many people stop taking their iron supplement because they think that they have enough iron. I would caution you not to do this. You need to be followed up by a physician or a pharmacist, and if you do have a true iron deficiency, you will likely be on iron for a good 6 to 9 months because we need to replace the iron stores in the body before you actually stop taking iron. This is something that often gets overlooked, and I see patients that are chronically anemic because after a few weeks they stop taking their iron. B vitamins. Good sources of B vitamins are meat, seafood, eggs, and milk. B vitamins are what we call water-soluble vitamins. They're vitamins that don't necessarily build up within the body. They're not stored within fatty tissue. You could speak with your pharmacist or your physician about the possibility of trying a very low B supplement to see if that helps with your energy levels during the day. I would encourage you, if you are taking a B vitamin supplement or if you do take one in future, don't take it right before bed. Take it in the morning because sometimes it really does give you a little boost of energy, and you don't want that happening right before you go to sleep. As I had mentioned, metformin is a medication that works very well for type 2 diabetes. However, one of the side effects is that it can lower B12 levels. Another reason we may have a lower B12 level is if we're older or if we have lower stomach acid. As we're older, we don't produce as much stomach acid. So as we get older, or if we're on medications, say, that may reduce the acidity of the stomach, you may have a low B12 level. Your doctor or pharmacist can order blood work to check you for low B12 levels. It's very easy to supplement B12, and we can do this through diet or we can do this through oral supplements. Sometimes if you have a more severe or more chronic B12 deficiency, your doctor will recommend sometimes a monthly injectable B12. And that's quite common. Sometimes we do need to take prescription medication or over-the-counter medication for sleep. It's quite common, and I do understand that there is a time and place for sleep medication. Often, if we are on these medications long-term, they can cause us to feel more fatigued. This is because many of these medications do not allow for a natural sleep cycle. So if you have been on a sleep medication long-term, it may be that you do need it and you do need to stay on it. But I would encourage you to maybe revisit this with your pharmacist or your physician. Look into maybe how this started and maybe how they could treat it in a way that would be a more natural approach, or something that would allow you to get a more natural sleep cycle. In my coming videos, I will be explaining different deficiencies, including iron deficiency, in more detail. So stay tuned. Those are coming. That's all for today. Thanks so much for joining me. I really appreciate your time. Bye-bye.